So firstly, I'd like to thank you for the invitation to participate in an event that I think actually has a huge amount of pertinence and relevance, certainly given the current pandemic. When we think about feedback in a virtual care context, there really is an overwhelming paucity of evidence supporting an optimal approach for provision of feedback in this mechanism. But I think that really creates an opportunity. Presently we have an obligatory immersion of training and assessment within virtual care that's provided an opportunity to develop best practices in evaluation and feedback. And so, Zina and I were conversing about some of our own personal experiences. We were discussing some of the positive and elements and some of the challenging elements related to virtual care and the provision of feedback. And certainly from the perspective of some of the value provided by virtual care, fundamentally, it really provides an increased number of encounters and opportunities for feedback, and certainly a blended opportunity of both virtual and physical encounters really does provide an opportunity not only numerically for greater feedback opportunities, but also a breadth of opportunities and different contexts that may actually provide some interesting features and certainly highlight certain elements and characteristics that are fodder for the provision of feedback to trainees. There's certainly much to what Heather was mentioning. There's an inherent versatility that is provided by virtual care, and certainly that also feeds into the mechanism of providing feedback. So when we think of virtual care, obviously a variety of different approaches, including video conferencing or telephone encounters. And really, these types of mechanisms of engagement have their own distinct and unique properties that provide certain opportunities. For example, video conferencing allowing one to join in real time and eliciting feedback, or at least conveying feedback, not only from the supervisor, the faculty, but also the patient themselves in sort of a dynamic interaction. But also, the opportunity in a telephone encounter, perhaps less seamlessly to do similar types of activities. And the other opportunity, of course, is the ability to message either during the encounter, following the encounter, either text messaging or using a variety of different messaging systems to basically communicate and sort of provide some feedback that may be actually segregated or isolated from the patient themselves and somewhat a little bit more anonymous, and certainly being able to communicate in ways that aren't typically found in a traditional physical encounter. The timing of the feedback provision is another element of versatility in virtual care. So, the ability to provide feedback during the case or following individual cases or collective summative feedback at the end of the encounter. And the other versatility is also related to the ability to structure the encounter to the trainee's level and also, provide feedback in context of the trainee's progression in their comfort with virtual care. And much to what Heather was mentioning before, different approaches in providing evaluation and by approximation feedback as well, with sort of greater supervision opportunities and directive involvement earlier on, and perhaps greater opportunity for more independent assessment and feedback provision at a latter point. Zina, can you think of any other positive elements that you found in your experience in providing feedback during virtual care encounters?
Yes, thank you, Ted, and thank you, Heather, for great opening tips for this session. As both of you mentioned, that there is a variety and there's a lot of opportunity to provide feedback. Essentially, feedback provided to resident, the principles are the same, whether it's face-to-face or whether it's virtual. However, there are pros and cons to this approach of virtual. I'm sure all learners and as a staff, we know when you enter the room, when a learner is seeing a patient, all the conversations suddenly get directed to the staff. And the learner loses that therapeutic rapport they already established, and they're trying to establish their training, their treatment plans and other plans. So the virtual care allows that interruption not to be present. The staff presence physically is much more in the background rather than in the forefront. So I think that's a really great advantage. So with the ability to go in and out of assessment, my tip for that as well, inform the patient. So initially, when you're starting any assessment in the virtual care platform, whether it's on the phone or on the video, inform the patient that I am doing this assessment of the learner. I will be coming in and out. So don't mind me. Don't think that there is sort of some intruder coming into that video. I might come in and then I might be still in the background. So that would not have happened in the physical space. You will not just open the door and come in and then leave and come back. There's a less disruption that way. The other thing is before you start the clinic, in addition to what Heather mentioned about setting the scene and knowing that you can access technology and all the sign in, also check with the learners what do they have access to. I've learned that some people don't have unlimited data plan or phone plans. Some learners prefer to use, let's say, FaceTime with the supervisor or WhatsApp. So make sure that you and the learner both have a way to communicate. The other thing is I've also learned that residents like to use text messages. So it's, especially if they are needing immediate help or they need an advice or they need the staff to intervene, keep an eye on your text messages because you really need to have that sort of real-time feedback and support. I would also say that the use of the virtual wait room is really great feature in virtual care. When a resident is seeing a patient and say they have a question or they want to formulate their treatment plan, it's so much easier to place a person in a waiting area virtually than saying you have to leave the room, you have to go somewhere, then you go find them, then bring them back. That really has a huge advantage with minimal disruption and time wasted. And the other point I want to bring as well, as a staff, we have to be very flexible in the timing of the feedback. And depending on the trainee level of comfort, we deal with very smart and very competent and very capable trainees. And some of the more senior residents might prefer the feedback to be at the end of the day, while the more junior residents or medical student after every case. So we have to be available, but also making sure scheduling of the patient. So you don't have a full schedule back to back while the learner have a full schedule and it's very hard to meet in between. So these are sort of some of the tips and what I have learned as well during this past few months providing virtual care through both video as well as on the phone.
Those are very good points, Zina. I think the other thing to mention is the applicability or utility of virtual care in a variety of different settings and where there may be some limitations. So, you know, in providing feedback for things like physical examination, obviously that there is some inherent challenge and limitation. The other part of it is also understanding that because of the immersion in technology in real time, for example, you know, communicating via video conferencing, there is the potential for distraction and lack of focus or distraction and attention, trying to multitask, and being aware that that actually may reduce the authenticity of the encounter, not only for the trainee, but also for the faculty member observing the trainee in the encounter. And so it's important to actually try to mitigate those potential distractions and provide a great degree of focus on the specific assessment itself and the sort of feedback provision. The technical challenges are always an issue and something you have to be flexible with in developing mechanisms of versatility, as mentioned previously. In the event of, for example, having a technical failure, a video conferencing network challenge, being able to readily, you know, alter the encounter to, say, a telephone encounter and being able to continue with the provision of rich feedback to a trainee with that in mind. The other sort of unique things that are offered by virtual care that really are somewhat unique to virtual care is the ability to record the encounter, obviously with the appropriate consenting prior to the encounter. But the ability to record and retrospectively evaluate the encounter and also have external evaluation of the encounter and you know, certain opportunities in more rich assessment from that perspective. The other opportunities really are related to what the encounter does to the trainee and how feedback may change over time. And you know, I've certainly been paying a lot of attention to this during the pandemic, in that there are a number of patients that we meet for the very first time and continue seeing in a virtual context. And theoretically, you may never see a patient in a physical sense during a sequence of encounters, and how that might affect the encounter that a trainee has, and by proxy, obviously, the feedback provided and how that might compare to a physical context. So it's important to be mindful of these things, and certainly in the development and evolution of feedback mechanisms and mechanisms of assessment in general. It's important that these influences and factors be kept in mind.
Right. Thanks, Ted. And one more point about the flexibility as well in the virtual environment is when you have, let's say, a complicated case and the learner needed more time or you needed more time, you can easily reschedule and add another further assessment at very minimal disruption to the schedule as well as to the patient. You're not going to send them home and bring them back just to complete the assessment. And the other flexibility you see is when technological failure. Again, you can always reschedule, much easier, much more manageable than having the stress of thinking how I'm going to finish this assessment and I don't want to make a decision in a rush. So essentially, there are a lot of advantages to the virtual environment when it comes to providing feedback. And the feedback we can provide with the video visit, obviously, we can provide even for the nonverbal cues, the posture, empathy, facial expression. But on the phone interviews as well, we will be able to provide the learners with feedback about, you know, how the tone of voice could be changed if somebody's, I deal with psychiatry and there's a lot of sad things, and, you know, you would expect people to have the empathy and change their tone of voice, or people get escalated or angry and we expect to calm down and de-escalate. So a lot of these variation in tone you can hear, and not only you can see, and you can provide feedback that way. And also to allow the learners to reach out to us in real time. I will be in the physical environment. It'll be really hard for the learner to come in and knock on the door when I'm seeing another patient, or I get called to the ward to do something else, or if they send me text message. You know, reality is we all have our phones, we all have our and we need to answer. And as long as we explain to the patient, if I get interrupted, this is what the scenario is, this is the circumstances. Just be respectful and mindful of the patient as well that you're seeing, while you're also attending to the learner's needs and also trying to provide them with the needed feedback. Thank you.
Thank you so much for a fantastic discussion around providing feedback. I think what I really took away from this was I heard you say the foundation of good feedback still exists in the virtual care environment, meaning that timing, structure, context, and level of learner really stays the same. But what we have in this context is perhaps some new flexibility within the confines of just good feedback hygiene. When we think about level of learner, I also want to highlight that for those of you who may work with more junior learners, there is a virtual care session that's being offered in late August or September through the faculty department faculty development department, that if you're interested, you can join on for those sessions as well.